folks. I'm back. Sorry about that earlier. There was a little bit of confusion here in the studio this morning. I'm Clint Lambert. I'm host of the Village of Motion show today. It's the Resident Council show. And this morning we have two guests with us. Carolyn Posey, who is the liaison to Ancillary Healthcare Services, and Jenny King, who is the chair of the Ancillary Healthcare Services Committee. And we're very glad to have both of you here with us.
Thank you very much.
Very first question, what is ancillary health care?
Well, the definition of ancillary is support.
Okay.
It's a group that supports, which certainly ours is. We cover many health care services, such as home support, home health, hospice, companion program, and physical therapy, outpatient physical therapy.
Okay.
So that we have quite a bit on our plate.
Okay. Run through that list again, if you would.
Home support,
Okay.
home health,
All right.
companion program,
Companion.
hospice, and outpatient physical therapy, or outpatient therapy.
Outpatient therapy. So there are 5 different entities or
Yes.
subcommittees or
Yes.
something. Okay.
Departments or whatever.
Departments, yeah. Okay.
Yeah.
And do each of those departments then, they're different from the medical center, right?
Yes, they're in support of the medical center, actually,
okay.
if you look at it that way, because home support and home health, well, home health particularly has to be recommended by a physician.
All right.
So that is certainly, and hospice comes into play through the medical center as well.
Okay.
And physical or any kind of therapy, outpatient therapy, has to be referred to by a physician.
Okay. So it really is a support structure, a support function.
Yes, all 5 of them are really.
Wow.
Yeah.
What is companion services? You mentioned
Companion is really a very interesting program, and I think not enough people really realize.
Right.
They're the young people who go around here in the blue shirts, and they are not medically trained, so they can help you unpack, go with you to a movie, or read to you, just anything other than a medical.
That doesn't require actually physical contact with the patient. I think that's the.
okay.
That's
okay.
what I have written down.
So it truly is a companion.
Yes.
Okay.
And we have some men, young men and women, and I think it's a wonderful program
it
that
is.
people don't realize.
Yeah, because I don't think very many people realize.
No, they would probably get home support where maybe they don't need any medical help.
But they would they still help someone in or out of bed or to the toilet or things like that?
I don't think they do that.
Okay.
I
So
don't think
it's more for being there to get somebody if you really need someone.
Yes, but I could certainly push a wheelchair
Yeah.
and be a companion. They don't drive,
Okay.
that kind of thing.
Oh, they do not drive.
No, but they would
Okay.
go with the person, for instance, in an automobile.
Okay.
It just doesn't accompany them.
This may be digressing here for a second, but I have seen Green Spring employees that I thought were home support or home health or one of those functions, driving residents' cars, going off campus and coming back on campus. Do you have any idea who that may be?
Are they in green?
They're in
or
green. They're in green.
They're in green. Well, then they'd be home support,
Huh, okay.
I guess.
Yeah, interesting.
Yes.
I was just wondering, if someone needs a driver or needs someone to take them somewhere to an appointment or something along those lines. Okay.
I know they do accompany people to a medical appointment. Home support.
Home support accompany.
Yes.
Does a companion accompany people to a medical appointment?
They could, but they wouldn't drive.
Oh, okay.
They would
All right.
just go along or maybe push the wheelchair, or it would be here, I would think, unless perhaps a member of the family drove, and they might accompany
Oh, okay.
the patient.
But they could probably take the shuttle.
Yes, they would do that.
To Walker Lane.
Sure,
If somebody
that
has
might-
an appointment over there.
They might do
Health
that.
place. Oh, okay. Carolyn, you're the liaison to this committee.
I am.
And describe your role, if you would, please.
Well, I report to the committee about things that are going on generally on the campus that members might be interested in, might not have heard about otherwise. And on the other hand, I go back to the council and report about what's going on with ancillary health services.
Okay. Do you get a report about each of these 5 entities, each of these 5 departments?
Not necessarily. It's sort of a whole thing. And
Okay.
each month there isn't something new each month for all of them.
Okay.
But there's always something new overall.
Yeah. All right.
Each month, we take one entity in those 5 that I named
Right.
and have a representative, a clinical manager from that department come and tell us what we need to know, what their jobs are, so forth.
What they're doing and how
What
can
they're
they-
doing,
Yeah.
how it affects the residents,
Okay.
and their connection with Medicare, for instance, which is a big,
Yeah, that's
a big.
That's really a biggie, right?
Yes, it is. When we hear all the restrictions and the rules and regulations, guidelines, it's really quite,
Unnerving at times.
yeah. But I guess Medicare really is looking out for us as
Right.
well.
At least that's what they're supposed to be doing.
We hope so.
I think all of it's questioned at times,
Yes.
in regards to it. But of all of those 5 entities, Medicare eligible,
Not home support. Home support is private pay.
okay,
And I guess companion.
Companion also.
companion
would be also.
would be not.
But the other 3,
okay, so home health, hospice, and physical therapy or
Therapy,
outpatient,
outpatient,
rehab.
yes.
Okay. Outpatient rehab is located in,
Hunter's Crossing.
Hunter's
the
Crossing
basement,
downstairs.
or
okay,
lower
downstairs,
level.
lower level, right? Okay. Home support is located
In Forest View,
Forest View,
lowest level.
lowest level, that's terrace level,
Yes.
I think it is, that's what it's called. And home health
Down there also.
down in
Yeah.
Forest View, terrace level,
And I think companion.
and companions out of
program
that
is too.
same office.
I think,
Yes,
yeah, I
yes.
think it's down
Okay.
there.
Yeah.
And physical therapy is located, we already talked about that.
And hospice.
Hospice. And the hospice is also out of that office?
I think so.
Okay, all right. I know at one time we had 2 hospice nurses, and I understand we're down to 1. I think it all depends on how many individuals are in hospice.
Yes.
Is that the way that
Yes.
operates?
Yeah.
Yeah.
Okay.
I think Kathy Craig is the head person in
okay.
hospice, and she has been to speak to us.
Right, okay, good. With the information that you get and the committee gets from the reports from the directors, managers, that kind of thing, what do you do with that information?
Well, of course, it's written in the minutes, and everybody gets a copy of that. And I'm not sure what our goals are.
Well, one of the things that we want to do is educate residents about what's available.
Oh, okay.
And for example, I think probably I didn't know anything about the companion program
That's-
until
yeah,
I got
most
into
people.
this, and I think most residents don't.
Okay.
So we do want to try to educate residents about what's available to them. I mean, and residents, and I think their families also.
Yes.
But that's a very touchy
Yeah.
situation, whether they've talked about it, that talking to families, for instance, about hospice before it's necessary
Yeah.
is a very difficult and
Yes.
just a very difficult thing to manage at the right time.
Right. Does the committee have the right, the legal permission to talk with family members about a resident?
I don't really know.
I don't know either, but I would doubt it.
Okay. I mean, I just happen to think about that. If someone's talking to a family member, what is the legality in regards to that? I would,
Well, that's where I think they're very careful
okay.
about
I think
what
that's
they do.
probably where social workers.
Yes, I would
come
think
in.
it would go
Yeah.
through the social
Okay,
worker.
Through social work, okay.
Yeah.
In
Yeah.
regards
I
to-
don't think that a committee of residents would be appropriate at all
Okay.
to do
Oh,
that.
no.
Okay. But you're saying that the committee is responsible for disseminating information and that you want to educate the residents for what's available. Do you have brochures?
Yes,
Yes.
yes, there are brochures on each of those
Okay.
entities.
Where would the resident get those? Get a
Well,
copy?
they're usually, they wanted some in the medical center. I think there are some in the medical center. And the places behind the cubbies where all all of the,
There, you know, a thousand
Brochures
brochures behind it. They're in there somewhere.
They're in there, the stacks of
Yeah.
Yeah.
material. Okay.
but they were trying to get them into the medical center and have so that the physicians would be aware of all the programs that are available
Right.
to them.
Because I would think someone needs to get to the physicians and
Yes.
really continually give them feedback and encourage them to
Yes.
to recommend that people do.
Yeah.
Okay. Does the committee now or in the future, is the committee planning on having programs about the different availability of things, or is it just simply a written, you read it?
Well, hospice did have a call-in show, if you remember.
Right.
And so that was that was early on with our committee. And I don't know, they're constantly having programs, I think, to try and educate the residents. But if they're on Channel 6, that is a little difficult sometimes for everybody.
Yeah, because unfortunately, there's a lot of people that still have difficulty getting Channel 6.
Yes, yes.
Yeah.
And getting the information out is the most, important thing we
Yeah.
can do.
Right.
But how to do it is the question.
Have you considered working with the communication committee?
Yes, we had a person from the communication committee come and speak to us.
Okay.
And so that we could probably work through them.
Because I was just thinking
That would
might be a route.
Yeah, that
Yes,
might,
it could be.
Yeah.
Yeah, in regards to that. Okay.
And perhaps the village bridge and would be another avenue.
The other thing I was just thinking is, what about the villager? Getting something in
Yes.
the villager about it, because it seems as if the villager truly has become what it was intended to be.
Yeah.
Yes,
The,
yes, it
the
has.
voice
yeah.
of Green Spring in regards to the voice of the residents.
That's a very good.
Yeah. The other thing is to point out to everyone, because I know that if I don't, Miss Madison will fuss at me, is the fact of getting people to refer to the village
Bridge.
the village bridge, where everything is laid out in
Yes.
regards to that. Okay.
That's right.
With all the things that you guys do, any thoughts about what else you could do to enhance the program, to facilitate things?
Well, that's what we're trying to come up with, some way to quantify what we do or what the various groups do. But we haven't come to that yet.
Okay.
Pamela Sutton is our
She's
overall
she's the director for all of that,
of all of these services.
along with everything else.
Yes,
Yeah.
along with,
A lot of things.
It truly is resident life. It involves
Yes.
Yes.
everything in
Yeah.
regards to that.
she comes to every meeting.
Oh, okay.
And we have a representative from each group come, one per meeting.
One per meeting. Okay, in regards to it. With this, Medicare is a primary reimburser.
Other than home support,
Yeah, other than
Or
home support,
companion.
or companion.
yeah.
Are there any regulations about having to be hospitalized prior to going to use these programs or take benefit? from
I
the
don't think so.
Okay. So it's just like anything else, physician ordered
Yes.
Yeah.
type situation?
Yeah, I don't think there's.
These are, of course, physician ordered,
Right.
to have any chance of getting it
Okay.
covered.
Any other items that you'd like to point out, discuss?
I think we've covered all 5 of them pretty well.
Okay.
Of course, outpatient therapy covers speech therapy, occupational,
Therapy.
and physical.
Oh, so it's speech.
Occupational
Occupational
therapy and physical
And physical
therapy.
therapy.
So there's 3 different
Yes.
sub-departments within that
Yes.
one department. Oh, wow, okay.
Yeah, we've had Nikki Halton, well, she's a member of the committee, and she comes every time, but she will bring whoever is in charge of, for instance, speech therapy and occupational, which will be our next meeting in June.
Okay. And you have spoken of your meeting a couple of times. When do you guys meet?
First Wednesday,
First Wednesday.
11 o'clock
Okay.
in the card room in Village Square.
Oh, okay. And how many residents do you have on?
7,
7 residents plus the 2 of you.
yes.
Okay. Nice sized committee.
It is. It's very manageable committee.
Yeah. Okay.
And they're all very active and
Yes.
interested,
Yeah.
Great.
very interested.
And this is the first year
Yes,
of
it
having
is.
that committee.
Yeah.
And Carol and I had something to do in regards to setting that up initially, as far as making it a committee as such, because everyone had a lot of concern about everything being under resident life and people not getting to realize it's a totally separate entity in regards to it.
There's quite a bit, really, in all 5.
Okay. Nikki is the manager of outpatient
Yes.
rehab.
Yes.
And excellent resource for people to go to.
Yes, we do.
Okay. It's a pleasure having both of you here with us.
Well, thank you
Okay.
for
Well,
having us.
thank you for having us.
Wow.
And we hope that this will be another way of communicating to residents what's available to them. I mean,
Yes.
Yes.
that's the big thing, is to have residents know that these things are available.
And I would certainly encourage people who've watched today or watch this at a later point to share with their neighbors, their friends, their table mates
Yes.
about it,
Yes.
and
Yes.
spread the word, because it's for a lot of us it's word of mouth in regards to a lot of the things in regards to that.
Right.
Well, thanks both of you. Very glad, and
Thank you
Thanks
very
for
much.
having
Glenn.
us.
keep up the good work.
Thank you.
Thank you.